Valika and Chavi is there. So you can call the next person.
Yes, sir. Yes, yes.
You can start the next.
Moving on to further presentation. Now I request presentation number OP251 to be ready for the explanation. Now I'm going to share the screen.
Hello, am I audible?
Yes, you can continue. So audible.
Audible? Okay, sir. Good evening, all. Here I am going to present my research work entitled as Accelerated Arthritic Incidence by Statins, X5O Antioxidant and Histopathological Analysis. Myself, Jithin Methew, working as an assistant professor in Department of Pharmacology in Nehru College of Pharmacy, Tiruvallur, Kerala. Moving to the ma'am, next slide. So, moving to the introduction, first we know about what is rheumatoid arthritis. Rheumatoid arthritis is a chronic systemic autoimmune disorder which is mainly characterized by the non-specific inflammation of the peripheral joints and destruction of the articular tissues, and which may lead to the deformity of the joints, I think so. Coming to the prevalence of the rheumatoid arthritis, in nowadays the arthritis is normally found in 1 to 2% population, and we know that women are more susceptible to as arthritis than that of the males due to some hormonal change or hormonal variations. And coming to the clinical manifestation of the rheumatoid arthritis, it may affect due to it may having arthralgia, swelling, pain, and articular tissues damage, which may be either due to the release of some kind of mediators, cytokines or neutrophils, leukotrienes, which may be having some actions on major histocompatibility complex. So that is the reason why arthritis can happen. Here I am taking statins. Statins are a traditional medicine which comes under the category of hydroxymethyl neutral coenzyme A reductase. This drug is more particularly used in the treatment of hyperlipidemia. Sometimes it is used in hypertension also. But here, continuous statin administration may lead to arthritis. So an observational study or a review work is conducted on this aspect. So that is the reason why I'm selecting statin and to check whether the statin accelerate the arthritic incidence in statin administered. So here I am taking two statin drugs, that is pitavastatin and lovastatin, a pure drug I obtained from or collected from Yarrow Chem Products, Mumbai, and continue the study. So aim of the study is to investigate whether statin have any role in our autoimmunity or it may trigger our autoimmune system. Next slide. Next slide. Next slide. Coming to the materials and method. Next. So here, before doing the experiment, I'm taking animals. So here I'm taking next previous slide, ma'am. Female albino vistaroids having weight around 150 to 200 gram, and other temperature, humidity, and all other conditions are maintained as per the guidelines of CPSCA. Here, animal experiments are approved by Institution Animal Ethical Committee. Here, I'm giving the number also. Next slide. Ma'am, next slide. Hello. Next, okay, here I'm taking first study is in vivo collagen-induced arthritic rat model. As you know, this is the most powerful tool for determining the arthritic incidence. Here I'm taking 6 groups, first one control, positive control, and 4 treatment groups. So for the control group, I'm taking phosphate buffer saline. For the positive control group, I'm taking collagen with the incomplete friends adjuvant. Then there are 4 treatment groups I'm taking. All these 2 of these treatment groups having taking pitavastatin before collagen-induced arthritic induction, and another 2 groups, that is treatment 3 and treatment 4. I'm taking lovastatin before and after CA induction group, after CA induction. So here, 4 treatment groups. Under this 4 treatment groups, 2 treatment group I'm taking pitavastatin giving, or the first statin giving before CI induction, and another 2 groups I am taking the drugs which are giving after CI induction. And here I am giving all the drugs in peroral, except in the case of positive control. Positive control, I am giving the drug in subplantar route, and the duration of study is around 42 days. Next one. Next slide. Next slide. So next slide. Ma'am, next slide. Hello. Okay, here I'm taking XY. After going this in vivo study, I'm collecting this animal tissues from the I'm collecting this animal tissues and going for this ex vivo studies. Here I'm taking 2 studies are mainly used, that is lipid peroxidation study and also superoxide dismutase activity. In the case of lipid peroxidation, it's a study which is normally used to evaluate the presence of reactive oxygen species formation. So, as you know, that lipid peroxidation is a study which will lipid peroxidase enzyme have a particular role to oxidating our cell organelles, or it will undergo mutation in our DNA, especially in the lipids. So that is the reason why it will stimulate the reactive oxygen species. So these reactive oxygen species, what they do, it will decompose the peroxide lipids. So that is the reason why it will release malonaldehyde. So normally, in the case of arthritic patients, if you check their serum or blood, it can elevate the level of malonaldehyde is found out. So malonaldehyde is actually found as an important mediator for arthritic incidents. So the procedure here I am using is taking a reaction mixer that is having 1.5 ml of 10 millimolar potassium phosphate buffer, then 0.5 ml of 30% of trichloroacetic acid, then 0.5 ml of tribarbiturate acid. Then all these samples are boiled at 80 degrees Celsius. Then it have for 60 minutes, then cool. Then we have measured the absorbance at 532 nanometer by using UV visible spectrophotometer. Next slide. Next slide. Here I am using the calculation is, as I already told you, this lipid peroxidation study, we are measuring the malonaldehyde level. So it is measured in nanomoles per milligram. The calculation here used is 3 into delta OD divided by 0.152. So here 0.152 is taken as the optical density of malonaldehyde at 532 nanometer, and delta OD is the change in optical density. Next. Next slide. Okay. Next is superoxide dismutase. Superoxide dismutase is also considered as an important enzyme which is having a particular role in catalyst degradation or arthritic incidents. There are two important type of superoxide dismutase are there. That is superoxide dismutase 1 and 2. One is normally found in cytosol, whereas 2 is normally found in the mitochondrial matrix. So the role of superoxide dismutase, it will promote a dismutation reaction, or it will catalyze our compound into molecular oxygen and hydrogen peroxide. So normally, in the case of arthritic patients, the superoxide dismutase activity is found to be very low. If there is no superoxide dismutase activity, which means that it indicates the patients having arthritis. Here the procedure is taken as 50 ml of joint tissue of homogeneous supernet, then added to 2.8 ml of this ADTA and 100 ml of 2 millimolar pyrogalal at 225 degrees Celsius. And optical densities or absorbance is measured at 420 nanometer by using UV visible spectrophotometer. Next. Hello, next slide. Okay, and then I'm using the histopathological analysis. So after 42 days, I'm taking ex vivo studies. Then the same day I'm going for histopathological analysis. On day 42, collecting the ankle joints from the animals. Then, as per the procedure of histopathological analysis, it's immersed in 10% buffered formalin for 4 hours, followed by decalcification in 5% formic acid. Then it is stained with hematoxylin, eosin, and evaluated under light microscope with the 10x magnifications. So this is all about the procedure. Next slide. So coming to the result and discussion. First one, lipid peroxidation study. Here I am taking the statistical analysis. I'm followed by one-way ANOVA, followed by multiple comparison to case post hoc test. So you can see the graph which indicate LPR level versus treatment groups. So all the 6 treatment groups are mainly indicated in different colors. As compared to the control group, all other groups having elevated level of lipid peroxidase enzyme. But in the case of after CA induction groups, that is lovastatin and pitavastatin after CA induction, how higher lipid peroxidase enzyme. Or we can see that all the 4 treatment group having elevated level of lipid peroxidase enzyme. We can find out from the study, which indicate that this elevated level or increased level of lipid peroxidase enzyme it will cause catalyst degradation, or it will promote rheumatoid arthritis. That is the indication obtained from the study. So as compared to control group, CI induced group, that is the positive control group showing some elevated level of lipid peroxidase, and then other 4 treatment groups, that is pitavastatin and lovastatin before CI induction, and pitavastatin and lovastatin after CI induction. All the 4 treatment grouping having higher lipid peroxidase group, enzyme level. Among these all four treatment groups, this lovastatin and pitavastatin after say induction group showing elevated level of lipid peroxidase enzyme, which indicate if you take this pitavastatin, if this treatment, this lovastatin and pitavastatin after say induction having higher rate of having more influence for the progression of rheumatoid arthritis. Now, superoxide dismutase activity assay. Here also we can find out that here. So, in the case of lovastatin and pitavastatin, for treatment grouping having comparatively lesser superoxide dismutase activity, we can find out. So, which as compared to collagen-induced arthritic group, so it indicates that all these four treatment groups having lesser superoxide dismutase enzyme, which indicate that having it will prevent the reactive oxygen species formation, or it will prevent the catalyzation of, or the superoxide dismutase is actually responsible for the catalysis of reactive oxygen species. But due to the decreased level of the superoxide dismutase enzyme level, so it does not catalyze the reactive oxygen species. So there are more amount of reactive oxygen species get accumulated, which will promote catalyst degradation. So here we can find out that in the superoxide dismutase, in this study, we can find out that all the four treatment grouping having very lesser, say, superoxide dismutase activity. So due to the lesser activity of or presence of this enzyme, it promote catalyst degradation. So here I got an assumption. We can find out, or assumption is that this for treatment group having it may promote catalyst degradation, or further it may causes rheumatoid arthritis, or it may accelerate the rheumatoid arthritis by decrease the level due to the decrease in the level of superoxide dismutase enzyme. Next. This is about the histopathological analysis. The result obtained from histopathological analysis can find out the case of normal control, arthritic control, and pitavastatin before say induction. So in the case of normal control, we can find out that there's normal spider tissue is found to be very normal, and we can find the polymorph cells, nuclear, other type of cells which are found to be leukocytes. All these cells are found to be normal. Whereas in the case of arthritic control group, the joint tissue itself indicate, can find out that there's a plenty of polymorph cells and narrowing of the joint space and narrowing of the striatal tissue. It is not found to be normal, which indicate the animal having arthritis. Now, the other two figure which indicate, that is pitavastatin and lovastatin before say induction, can find out that a lot of polymorph cells and leukocytes and narrowing of the joint space, all these things we can find out from here. So this indicate that this the animal showing arthritis, or animal this group having arthritis, or it will promote arthritis. Now, in the case of after say induction groups, that is pitavastatin and lovastatin after say induction groups can also showing the same pattern. Pitavastatin after say induction having narrowing of joint space and congested blood vessels, we can see, and plenty of polymorph cells, leukocytes, or other cells. This kind of cells we can find out here, which indicate this group also possessing arthritis. So between among the histopathological analysis is conclude that among this all the four treatment groups having arthritis, or if you isolate or excise the joint tissues and perform the histopathological analysis, from the analysis we can find out that all the four treatment group promote or accelerate the arthritic development. So coming to the conclusion, lipid peroxidase enzyme is indicating the elevated level of malonaldehyde formation through oxidative stress. And superoxide dismutase activity on branch joint tissue was found that decreased expression of SOD level will contribute. That is, superoxide dismutase level will contribute due to catalase degradation. So overall, lovastatin had a strong influence on accelerating arthritis onset than pitavastatin. The study claimed that statin use was associated with the increased risk for developing rheumatoid arthritis. So, from the study, I can find out that if you use statins continuously in rheumatoid arthritic patients, the statins have a particular role to accelerating the arthritic development, or it will possessing some, it will deregulate our immune system. So that is the reason why it will stimulate the release of a lot of mediators. cytokines, human necrosis factor, all those mediators, it will further progress the development of arthritis. So these all are my references I obtained from the studies. Thank you all for giving me an opportunity. Thank you so much.
It's a good work, but you didn't mention about the dose of the statins that you have used. What is the dose in which you have used the statins?
For the case of actually it's a pure drug I'm taking, uh, and it will convert into animal dose. Then only I'm taking here injected into animals.
What is the dose?
I think it's around 20 milligram per kilogram per dose. That then hello.
In research, you can't think no, because dose is a very important factor here.
Oh, okay, sir.
Okay, your total research is based on a spectrophotometer instrument. So when did you validate your spectrophotometer?
Actually, the study, all these two studies, I performed in outside, so um, uh, they were also did all those things.
So you outsourced the research work.
No, no, no. Only these two studies only I did outside.
No,
External.
that is the main crux of your research. No, okay. So finally, what do you advise for the people who are aged and who are on statins and who have a chance of what you call moving towards arthritis? What's your final advice? They
So
should.
yeah, if the patients who are taking statins, definitely you should be aware about it, because statin use, continuous statin use, it's not effect. If you use frequently, there is no problem. And normally hyperlipidemic patients, we know that they were using statins continuously or a regular basis. So that is the reason why if regular consumption of statins may accelerate, it will accelerate the arthritic incidents. So that is the reason why patients should vigilant about all those things.
Okay. So further studies are required in this area. Good. Over to my colleague.
Yeah, no question from my side, sir.
Yeah, from
Yeah,
my
you have
end,
asked few questions I wanted to ask.
okay. So can you explain the mechanism behind for the lipid peroxide reactions? And it is a colorimetric method, right?
Yes, sir.
Explain for the peroxide reactions.
Yes, yes. Lipid peroxidase enzyme is actually which will promote the degradation reaction. It will causes a oxidative degradation reaction in the cells. So it will affect mainly on the cell membrane or lipids. So first it will cause oxidative degradation. It will start to release reactive oxygen species. As you know, this reactive oxygen species, which will further undergo oxidative stress by decomposing these peroxide lipids. So by using that process, it will start to release malonaldehyde. So this malonaldehyde is elevated level of this malonaldehyde is actually found as an indicator of arthritic incidence. So normally these arthritic patients having elevated level of malonaldehyde. So by using this lipid peroxidation study, we are commonly used to estimate the level of malonaldehyde, how much malonaldehyde is present there. So if the elevated level of malonaldehyde may cause arthritic development or arthritic progression.
Okay, what is the color you are appeared? It was appeared for the colorimetric method. Your the
Yes.
lambda max is 523 now.
Yes, sir.
What is the color?
Still, I'm not remember actually. Sorry, sir.
Okay. You have to remember, right? Because you have
No,
done
no,
only
sir.
studies to confirm your activity. That too for the spectroscopical method. So when we are doing for the things for the validation as well as validation parameters, as well as such that for the other parameter as well as for the. I think are you personally involved this particular work?
Yes, sir. Yes, sir. I did this work, but this to study I performed in outside. And that's not
Okay, fine. You are
facility.
even
That is the
outsource
reason.
fine, but are you involved even outsourcing also? Whether your presence this particular work is carried out or not?
Not my presence it is carried out.
Not your
Actually, they.
right. So you made anyway. Your explanatory towards for the mechanism is good. So towards for the chemistry part, you have to be kept. Means chemistry means analytical parts bit.
Oh,
Okay,
okay, sir.
right, right. Anyway, your aim is for towards pharmacology. Okay, fine. Anyway, fine. Good.
Okay, sir. Okay, sir. Thank you.
Over to organizers.
What is